think that would that will also really help kids as well, especially when it comes to maintaining attention and this whole stigma around ADHD. I think there was someone very prominent that I read that a lot of these cases are actually misdiagnosed. It's not that they've just got this ADHD, it's because of the amount of sugar that they're intaking and the amount of distractions around them that's affecting their focus. That's a big factor, in the problem that we have, especially with the younger generation centering around sort of lack of discipline, lack of focus. It starts with the amount of sugar that they're having, especially in these foods that are being packaged up in very attractive marketing schemes that actually may be portrayed as healthy but are actually not.
Yeah. I mean, ADHD really is not a medical condition. It's a metabolic and lifestyle condition. It's completely down to their environment, the way they're raised, and what they're fed. Like they're given a bowl of cereal in the morning, which is sugar. They're sent to school. They're given like a sugary treat at school. They try and make them sit still. And in fact, I actually, a while back, I was listening to something really interesting on ADHD, which was we're talking about with kids that actually I think it was saying about it wasn't that their attention is understimulated. It was actually that it's overstimulated. And it's kind of the opposite of what people think, that they can't concentrate on stuff. It was almost that they were too hyper-focused with all the sugar and everything in their body, that they were so hyper-focused that they then couldn't do anything. I can't remember exactly what it was. It was quite interesting, but there's kind of more intricacies to it than people think, but it's definitely not something that's solved by putting them on pills. You're affecting the rest of their life. You basically just all those pills do is basically just try and turn them into a robot and just dull everything down. So all of their emotions, all their thoughts, everything about them just dulled down to nothing, which you don't need. And I also was listening to a podcast the other week. They were talking about health with kids, and about even in kids' medicines. Kids' medicines like say antibiotics or whatever, they come coloured, and they have a food dye in them, and you basically can't get them without the food dye, and that food dye is basically terrible for them. And lots of kids have had, like, when they have the medicine, parents will notice the difference, their behaviour and everything, but yet they won't give that medicine to kids without the food dye. Like, why does it matter what colour it is? It doesn't even change the taste, and it's just they're just poisoning kids. You've got to be careful. I'm trying nowadays be so much more careful of what I give to my kids, and I kind of look back on their earlier years before I kind of knew all this and think about all the stuff I maybe gave them, thinking, I shouldn't be feeding them this and that, and got to try and improve it as you're improving your own diet too. But yeah, it's the diet of kids nowadays is not helpful for them at all.
As you say, you're talking from experience with your own children, and you've got to marry all the aspects together and make sure that it's balanced out. And I always think it's a bit tricky with kids, because they are growing and they do need a certain amount of food to help their joints and their muscles, and because they're growing, their muscles are getting bigger, they're going through different their body's going through various different stages through puberty and everything. So the amount that they're eating, whether, like, for example, at breakfast and lunch no longer exists for me. It's no longer required. My body's completely adapted to that 4-hour window. But for a child, for example, eating, in terms of what they're eating, that's pretty solid, pretty clear on what we should be feeding our children, what we shouldn't be. But do you try, is it a bit tricky to get them, do you still feel that it's best that they eat 3 times a day, or do you think that they need their breakfast in the morning because they are growing and they still are going through that stages of maturity? Or is it really just in terms of what they're eating, or if they're not hungry, they can go to lunchtime?
Yeah, so I do keep them. They eat more regular than I do. like you say, with kids growing, I think they do need more regular kind of sustenance maybe than an adult.
Yeah.
And the other thing that is hard with kids is if like I'd have had all this information and known it like when they were born, before they were born, it would be a lot easier because you could start them eating the right way. The problem is with kids, all like baby food, kids food, as soon as they go from milk to anything that's solids or whatever, it's pure sugar. All baby food, like the tins of it and the packets, everything, it's just pure sugar. So they're basically raised on just sugar. That's what they're accustomed to. So then trying to transfer them from that to more of like a meat-based diet can be harder. So